Relax, sit, relax. Welcome. It's season 2 of Make Your Day Richer, and we're back. And I'm Richard Wilmore, your host. And we're going to go through this little adventure together. And I'm excited. We have a lot of amazing guests lined up already. Today's day 1. We're going to do this Monday through Friday. And we already have about 50 people lined up. So get ready. So click that like button, click that share button, click that follow button, because it's about to get started. Today's guest is Kyle, the founder of Health Market Genius and a trusted guide through the maze of health insurance. With nearly 3 decades in the industry, Kyle has helped thousands of people, from entrepreneurs to families in crisis, find coverage that fits their lives and budgets. His mission? To simplify the process, cut through the noise, and make sure no one feels lost when it comes to their healthcare options. Kyle's blend of expertise, empathy, and real-world stories make him the kind of guest who turns a complex topic into a conversation you'll actually enjoy. Are you ready? Click the like button, click the share button, and let's start the show.
Make your day richer than it was before. Got some good times knocking upon your front door.
Well, Kyle, thank you for being here.
Thank you for having me.
Of course. I think what you do leads to, this could be a 12-part series, I'm pretty sure, because you're in the business of insurance, health insurance.
I am in the business of health insurance.
How in the world did you become the founder of Health Market Genius?
Well, I've been in the insurance business for about almost 30 years.
Okay.
And when Obamacare kicked in 2014, I realized that was a game changer. I mean, that really changed everything dramatically.
Mm-hmm.
And I thought to myself, wow, I think if I can be good at that, if I can become an expert on how that works, I can help a lot of people. So that really was my motivating factor. And so that was 2014. At the time I was working for a company. So a year later, I left that company and just started my own business.
Wow.
Yeah.
And how has that been, owning your own business? Like, what has changed from just like selling the insurance to now kind of being more in charge of things?
Yeah, well, it's a pretty dramatic change
Yeah.
because at the time I was selling all different types of insurance. Now I just focus just on health insurance,
Okay.
which I think is really important because, when you sell a whole bunch of different products, your attention and your mind is spread out across those products. But to just do one, that really helps me stay focused, helps me concentrate, helps me um, keep that as the main concern when I'm dealing with clients, the only concern. So yeah, it's been a very good run for me, and I've been blessed because people share my name a lot, so I stay very busy.
Yeah.
But and it's a dynamic product. You hear it in the news, the Affordable Care Act, Obamacare. It's changing. It's going to be changing this year coming up. It's changed in past years, and the one promise I've made to my clients is that I'll stay on the cutting edge. I'll let you know how it affects you. I'll let you know what your options are. So that's how it's shaken out.
Yeah, I think there are a lot of rumors and myths and all these like stories that surround the Affordable Care Act. Or can you share some insight into like maybe some things that people might think are true that aren't?
Yes. So first of all, we're talking health insurance. So it's not the most exciting subject in the world, but if you are self-employed, if you are somebody who does not get coverage through an employer, if you're between jobs, or if you're a college student, you have to work out your own insurance. This information is important to you. You either have to learn it yourself or you have to use an agent. It doesn't have to be me, but somebody who can give you guidance. So there's a lot of things out there, a lot of misconceptions. Probably the biggest is that people, I talk to people who are maybe in between jobs and they said, well, I just don't really have a lot of money to spend on this. And the good news is you don't necessarily have to have a lot of money. A lot of my clients, about 95% of my clients, get a subsidy. They get a tax credit, which means they get help from the government that pays all or part of the premiums. So that makes a huge difference. So when I hear that from somebody that says, well, I don't know if I can afford this, I think, well, I probably have some good news for you. You're going to see some premiums that are better than you probably think.
Wow.
So
Yeah, I think can we also talk about the because I don't even know all the terms, so you're going to probably have to help me. What the Affordable Care Act and Obamacare, and then isn't there also like another layer of insurance? Because I think I fell into this trap at one point in my life that I thought I was getting something in the Affordable Care Act umbrella, and
yeah.
I wasn't. And then it turned out there was a whole lawsuit, and I got some money back.
Well, it's very easy to really be fooled
Yeah.
into getting something that isn't what you thought. The plans that meet the Affordable Care Act, that's always what you want to get, in my opinion, because they cover pre-existing conditions, they give you free checkups, they do a lot of good things for you. And that was all part of the law, and including the subsidies and maternity, things like that. But there are a lot of people out there who market some type of health insurance, and they won't tell you that it's not an Affordable Care Act plan. They're going to call you. You'll have telemarketers calling you especially if you click something online that says,
"Oh yes, I Googled.
Send me information about health insurance," or call me, whatever. It'll be nonstop.
Yeah.
So a lot of people can be fooled, but you really want a policy that meets the Affordable Care Act guidelines. That's the way employer plans do. Like if you work for Apple or Google, you're going to have a group plan that meets the Affordable Care Act guidelines, does all those good things. And you want to have a policy, ideally, that does all those things, and ideally that is not expensive.
Okay.
So that's what I help people figure out.
Is there an enrollment period? Like, can you just enroll anytime could I just do it tomorrow?
Yeah.
Or is it like certain type of year after
Yeah, it's a good question. It's a good question. So the way it works, and they've started enforcing this because they were really lax on it for a number of years with COVID. But the way it works is anybody can enroll at the end of the year. There's an open enrollment period, and anybody can enroll at that time and choose whatever plan they want. So that is a very, very busy time for me. And that basically runs from November to the end of the year. To enroll now during the middle of the year, you have to qualify for a special enrollment period. So that might be you leave a job, you leave an employer, you move to a new state or even a new county, you have a baby. So there's a variety of different ways where you can qualify for that special enrollment period and get coverage during the middle of the year.
Okay. What about some challenges getting covered?
So there's different concerns that people have. Sometimes they have a high income, and the premiums, if you have a high income and you can't get the subsidy tax credit, then the premiums can be high, or at least higher than what people consider to be high. Other times I run into people who now want to get coverage during the middle of the year, and they don't qualify for that special enrollment period. So now they're like, okay, well, what can I do? So I help them evaluate those options. Sometimes I talk to people who shop for coverage on their own, and they really didn't do it right, and now they've got some problems or issues, or maybe they estimated an income that's too low, and now the government wants them to pay some money back, things like that. So those are all things that nobody wants to go down those roads, but things I help people with.
I think as someone who fell into the trap of getting the wrong insurance, and I had other people looking at all the forms because you get all this information, and I didn't understand it. So I think it's so smart to get someone like you who can understand all of it, who can walk you through all of it, because I was completely lost when I did it.
That's very typical. And one thing I've discovered is that, there's a lot of people can do things on their own online. Young people, they can get online, they can do things, they can, obviously people do a lot of stuff these days on their own. But when it comes to health insurance, there's a lot of nuanced things about it. And you have to be really careful. It's pretty easy to mess it up. So I tell people, look, my services are free. I don't get paid by any of my clients. I get paid by the companies they choose. I'm a broker. I deal with all the companies. I deal with Blue Cross Blue Shield, Aetna, United Healthcare, Ambetter. So I deal with all of them, and they pay me when somebody signs up. So my only motivation when I'm talking to somebody is, how can I put you in the product with the company that's best for you? I want you to be happy. I want you to refer me. I want it to go very well. So that's I'm a dog in the fight when it comes to companies or plans. I want to put you in what's best for you.
Do you ever hear from people that you've helped find insurance, or is it one of those things where it's like, I wonder what happened to them? Like,
No, I hear a lot.
Good.
I hear a lot, and I'm blessed where you're in a business where it really can make a big difference.
Yeah.
I had one lady, for example, who called me. Her husband needed a heart transplant, and I've never had quite that dramatic a scenario. I mean, think about that, a heart
Yeah.
transplant. That's about as extensive as it gets. So, we got to talking, and I said, "Wow, I'm not even sure if that's covered." So I did some checking, and sure enough, organ transplants are covered by these plans that meet the Affordable Care Act guidelines. So we went down that road, and I helped her. Unfortunately, her husband died. Okay, she was actually on the tail end of that, and her current company was telling her, "We're not going to pay for your husband's heart transplant," but he died before that even could occur.
Wow.
But she remembered that I helped her, and after everything and the funeral and all this state type stuff was taken care of, she came back to me, and I helped her with insurance for her and her kids, and she's referred me several times. So
Oh, wow.
yeah, I'm blessed where I do get to talk to people after the fact, and I try to stay in touch anyway. And
Yeah.
it's just part of my marketing. I send out postcards and just remind them, hey, if there's anything I can do, let me know. Here's my contact info.
What are some things that people should have prepared before they come to you or they're looking for insurance to begin with?
I think probably the most important things are, number one, who are their doctors that they need to be able to see? Okay. Number two, what are their meds? What are their medicines that they need? Number three, what's an approximate income that they think they're going to make for the year, for the current year? Adjusted gross income. So those are, if they have the answers to those three, and the income can be a guess. We don't have to pin that down exact. I tell people, take your best guess. I get a lot of entrepreneurs, people who leave the corporate world, they're starting a new business, they don't know what they're going to make. So I tell them, look, take your best guess now, and then let's revisit this in 2 or 3 months and make sure that's still going to be an income that looks good.
Okay.
So
I was just, I think it was TikTok, of course, because everything's on TikTok. I was watching this woman who doesn't have health insurance, and she puts the money that she would put towards her health insurance in a savings account, and that's how she pays all of her medical stuff. What do you say to people who choose not to carry insurance?
Well, I'm sympathetic to some situations. If somebody makes an income that is too high to get a subsidy, then they can be looking at paying a lot of money for insurance. I mean, if it's someone in their 60s, and let's just say they make a decent income and they don't want to they don't want to spend, $900 a month on insurance. That's a lot of money.
Yeah.
I get it. that's a big chunk to pay. But on the flip side, I think to myself, the exposure, the risk that you take if you don't have it, that's pretty scary, because if just a knee surgery could be $30,000, and that could happen to anybody. Or you could get, you could have appendicitis. And my son had that a few months ago. He was in the hospital for 2 or 3 days while they dealt with this appendicitis. That kind of bill could be $30,000, $40,000. So I understand the concerns people have, but it's a big risk. At the very least, what they should do is evaluate their options. You'd be surprised how many people I talk to, and they say, well, I just went without it for 6 months because I just thought it'd be too expensive. And then when we look at it, it's not. It's they're like, wow, I didn't know that. So I'm sympathetic to it, but at the very least, they should evaluate their options and know what they can do and what's out there.
Yeah. What's your radius of where you work? Can you work with anybody, or are you?
I am 99% in North and South Carolina.
Okay.
Okay. I am licensed in some other states like Tennessee and Florida and Texas, a variety of other states. And I tell people, I get referrals from a lot of different places. And if I can do it, fine. And if I can't, I tell them, look, I'm not licensed, in Ohio, but what I can do is I can pull up the Ohio plans. And I don't mind looking at them with you and just saying, well, if I were you, this is what I would do. This looks like a good plan. So I still help people. I just wouldn't be the agent of record. I'm not going to get paid for it. But I don't mind doing that. I just feel like people are better off, getting some advice or at least talking to somebody who knows the industry, knows what plans look like. And I'm happy to do that with anybody.
Some sort of stepping stone, because it can be so much information.
Yeah, it can be overwhelming. And there's a lot of garbage out there.
Yeah.
You mentioned you ran into an issue. Well, think about somebody, shopping in other states. They're running into it too. So, if they can talk to someone like me, I can definitely get them on the right track.
And what's the best way that people can reach you?
Well, they can go to my website, which has my email and my phone number. It's healthmarketgenius.com. They can email me at kyle@healthmarketgenius.com, or they can call me. It's 828-266-1369.
And his address, if you want to just show up at his house on a Sunday afternoon, is no,
That's
no,
right.
we won't do that.
So,
What's making your days richer these days?
I get a lot of satisfaction from helping people. Just knowing, I told you the story about the woman with her husband needed the heart transplant, but I get a lot of stories like that. So that really speaks to me and motivates me and makes me feel good about it. I also have a son who is bipolar. So that there's a lot of people out there with mental illness who are looking for good coverage. And a lot of those people feel they're the people who feel like, oh, I can't get anything. It's going to be too expensive. They've had problems. They've run against brick walls. So I love helping people like that because there's good answers to that. You just have to know where to look and who to talk to. And if I run into people in those situations, I get a big kick out of helping those folks.
I think, and this is probably going down like an HR thing, but for medical things with the Family Medical Leave Act and all of those things where people are afraid to leave their jobs for a period of an extended period of time because they're afraid they're going to lose their jobs, but that's what it's there for, right?
Well, and I talk to a lot of people like that. They say, you know what, I'm thinking about leaving my job. I want to start something new, or maybe they're going to retire. They're 60 years old. They're going to retire. Medicare doesn't start till age 65. So a lot of times they'll have a gap. So they'll contact me before they leave and just say, hey, I want to leave, but I'm afraid. I don't know what health insurance looks like. So I give them quotes. I tell them, this is how things work. This is what the quotes look like. And at least they have peace of mind to know, okay, that's what it's going to cost. And then they can make a decision based on that.
I love that. What are we missing here? Kyle was so nice and he made me notes. Am I missing anything? How can people sign up?
Yeah, so that's a great question. So people can sign up. They can, if they don't want to use an agent, they can go to healthcare.gov and just do it on their own. It's a little tricky. Unfortunately, the questions are kind of nuanced. They're kind of vague. It's kind of easy to screw it up. So I tell people, look, if you let me help you with it, we'll make sure it's done right. I've done it many, many, many times. And, they answer a questionnaire for me, and then I'll process it for them. And then, I can tell them what to expect because I've seen so many different scenarios. If there's going to be a problem, I tell them that. I don't always have good news, but at least they know the deal. They know, what the situation is. And I'll usually give them a suggestion about how they can handle that. So the best way is just contact me. But if they don't want to deal with an agent, they want to do it on their own, they can go to healthcare.gov and try to sign up.
But you should just call Kyle.
Yeah.
Why wouldn't you?
I appreciate
Kyle,
that.
before we leave today, will you play a game with me?
Sure.
Okay, it's an easy game, I promise. And if you win, everyone in our non-existent studio audience is getting a thermos travel mug. Okay. Look at that, everyone's clapping, all right?
Yeah.
I call this game 3 in 5. Okay. The category is insurance. Okay. No, this is not 3 in 5. That's a different game. This is just a bunch of types of insurance that I'm going to try to explain to you, and you have to guess what they are.
All right.
And if you get 3 out of 5, everybody in the audience wins.
Okay.
It's all random, even though I made it up. Ready?
Yes.
This is if you own your own store or your own your own
business?
Thank you. Yes, business. Yes, that's the only word I could think of was business.
Oh, okay. So
it's business insurance. Yes.
Okay.
When you are getting on a plane and you're going somewhere, you might need
travel insurance.
Yes.
Okay, I get it. You say
okay, here we go. Here we go. The vehicle you drive.
A car insurance.
Thank you. Okay, we'll do 2 more. Where you live.
Home insurance.
Yes, last one. Or if you don't own the home,
renter's insurance.
There you go. Everybody in the audience, thanks to Kyle, is getting a travel mug from Thermos. How amazing. Kyle, thanks so much for being here.
Yeah, great.
I appreciate that.
Awesome.
Yes.
Yeah, thanks a lot.
Before we go, are there any like upcoming dates that people need to be aware of?
Yes. So the open enrollment period where people can sign up for coverage starts November 1st.
Okay.
Now the effective date would be January 1st, but that's when it starts, and that's when I'm telling people, look, contact me if you want to know what the 2026 plans and rates look like. Contact me around November 1st or after, and I can help you with that.
So put that on your calendar right now. Tell everybody the website again.
That's healthmarketgenius.com.
There you go. Kyle, thanks.
Yeah, appreciate it.
Thank you. We're going to take a break, and we'll be right back after this. Don't go away. Life is difficult. Are you feeling overwhelmed or like you could use a little support for your mental well being? Visit the Help Hub. It's the most comprehensive and inclusive free online destination for mental health resources, helpful tools, crisis hotlines, and supportive content. Just go to thehelphub.co to find the resources you need when you need them most. Unlike other resource pages, the Help Hub is divided into 16 different categories, ensuring that everyone in every community has access to the resources and support that matches their unique needs. Find the help you're looking for at thehelphub.co. Hey, welcome back, everyone. You know, the show is really supposed to be a show that you can come to, learn something, meet someone great, and forget about all the things that are happening outside in your world. Sometimes it's really hard to forget what's happening in the world, and we shouldn't be forgetting all of the awful things and the good things that are happening out there. And that's what this show really is. I wanted to create this show to give you a space to go and smile for a half an hour, to learn something for a half an hour, to find that person that I'm talking to on social media and interact with them and know that they changed your life. So that's what this is. If you want my opinions on other things, just ask me. Come over and hang out with me and ask me, and we can talk. On tomorrow's show, we've got the author, Jamie Weatherly, of this book right here. It's called Unloaded. It's a great book that he has written about his life and addiction and sobriety and all the work he is doing in the local community to help others. A really great guy, and I'm excited for you to meet him. So come back tomorrow for that, and we will see you later. All right? Hey, go buy me a coffee at buymeacoffee.com/makeyourdayricher so I can come back tomorrow and next week and the week after and give you amazing shows. All right, everyone? Have a great day. Bye-bye.